Trigeminal neuralgia is a very severe, stabbing, short-lived pain in the face, glaring at the edge of the lip or chin. In its pathology, it's thought that trigeminal nerve, which is the fifth cranial pair and pierces of the sense of the pace, is caused by a close proximity of the vessels in the region where it exists from the brainstem. It is most frequently seen in primary and secondary in multiple sclerosis disease. Carbamazepine is the main drug, the pain relief of the patients, giving proofs that the patients have neuralgia. Most of these patients apply to the dentist due to a dental problem and come to us with many teeth extracted. Since it can be triggered by daily routines such as cold hot, eating, touching the skin, brushing the teeth, it affects the lives of the patients a lot. Surgical treatment is also applied in patients for whom drug therapy is not sufficient or side effects of the drug occur. 4 types of treatment are performed in trigeminal neuralgia. The first is the Trigeminal RF method. While the patient is under sedation, a needle is inserted 2 cm from the lip and the brain is reached through the hole called foramen ovale, and the ganglion of the nerve is burned with the RF. This is a destructive method, does not eliminate the existing cause. But the pain goes away in minutes and the patients go home after 2 hours and continues his normal life. It should be shared with the patient that there will be numbness in the half of the treated face. In general, half of the patients undergoing radiofrequency have undergo the procedure again after 5 years. Even if it is burnt at low doses in order not to cause numbness in the face, it recurs within 2 years. Applied in operating room conditions and under X-ray. The second method is the balloon method. Under general anesthesia, the nerve ganglion is reached from the foramen ovale with a needle in the same way. The balloon, which is passed through the needle, is inflated and the nerve is destroyed by pressure, pain-free when the patient wakes up. It's a disadvantage that facial functions cannot be controlled during surgery. The third method is gamma knife. It's applied in patients who are very old and cannot be operated due to systemic problems. Those who have undergone finer interventions and those who have relapses and MS patients. With a head-mounted frame, radioactive rays destroy the trigeminal nucleus. The good effects occur after a few months, like 6 months. It's a repeatable method, not recommended for young and healthy patients. Microvascular decompression MVD surgery is the golden option for young and other age group patients who do not have any health problems. This is an open surgical procedure. The skull is entered through a hole drilled in the lower back of the skull. The cerebral cortex opens, advanced, using the natural space between the cerebellum and the bone, and finds the place where the trigeminal nerve exists, the brainstem. Adhesions around the nerve are opened. The vessel pressing on the nerve, which is close to it, is carefully separated from the nerve, and insoluble Teflon material is placed between the two. With this procedure, the pain of patients with stabbing pain passes over 90% and does not recur. There is no percent numbness. CSF discharge and seventh nerve injury are common complications that should be known. In the pain changes character in trigeminal neuralgia patients, if the sharp and short-term pain becomes continuous and burning, or if the patient develops autonomic symptoms such as redness and tearing in the eye during pain, fluid coming from nose, the chance of success of the surgical intervention will decrease by nearly half. This information should be shared with patients.